Alcohol-related liver disease has become a common disease, but it is certainly a preventable disease. Today, we are very pleased to have Dr. Vladimir Marquez to speak on this important topic. Dr. Marquez is a gastroenterologist and transplant hepatologist at the Vancouver General Hospital in BC. His interests include portal hypertension, liver failure, and vascular liver diseases. He is also actively involved in the management of patients with hepatocellular carcinoma. Please join me in welcoming Dr. Vladimir Marquez and our host, Valeria Zaborska.
Welcome, Dr. Marquez. It is a pleasure to have you with us. So for our first question, can you please tell us how does alcohol affect the liver and how common is alcohol-related liver disease?
Well, good afternoon. Thank you for having me here today. So alcohol can affect the liver in several ways. The typical way that we would see is by producing fat in the liver. So this is the first spectrum of alcohol-related liver disease. And of course, after that, if there is ongoing damage, just like any other liver disease, we can create inflammation and then scarring that will lead to cirrhosis of the liver. In addition to that, sometimes we can see alcohol manifest in a very acute and aggressive way that we call the acute alcohol-related hepatitis. And finally, it can also be a risk factor for developing liver cancer. As to what common it is, it's very difficult to have, all the numbers. I can tell you that last year it was alcohol-related liver disease was probably the 5th most common cause of mortality in people that were aged between the 55 and 65 years old. So it can be very common. The reality is that we see that very often. Most of the time, it is not a very serious manifestation, but certainly can affect maybe close to 5% of the population.
Great, thank you. And what kind of dysfunction does alcohol cause in the liver, or what functions of the liver does it usually affect?
Well, it will affect the same types of function that any other liver disease would cause. So there's nothing really that is specific to alcohol that we don't find in other liver conditions. So we would see the same type of problems, starting by the inability of the liver to clear toxins, to detoxify the body, and then create further, as it creates further damage to the liver, then we will see other manifestations such as jaundice. People can develop also fluid in the belly that we call ascites as another manifestation. It can also create bleeding from the gastrointestinal tract in very severe cases. And when the toxins accumulate to an extent that they can get into the brain, they can also lead to problems of confusion. But none of these are really only specific to alcohol-related injury. It is really what we will see in other types of liver disease.
Okay, so then further on that, and you were mentioning alcoholic hepatitis as well, and some of the symptoms and signs patients can present with. How is it usually diagnosed if you're suspecting alcohol-related liver disease, and how dangerous or fatal is it?
So one of the problems with liver disease in general is that it doesn't create a lot of symptoms in its early phases. It's really when it's very advanced that we are going to start seeing symptoms and then signs of liver disease. So the usual way that we would be able to detect sometimes early phases would be just through blood work that is being done just as a regular checkup, I would say, of body functions, and that it will detect that there are some anomalies with the liver enzymes or liver function. That will be the early way to detect it. Sometimes an ultrasound is performed for some reason, an ultrasound of the abdomen, and then we take a look at the liver and we see the fatty deposits in the liver as well. That will be the way to detect it early. Unfortunately, when it starts giving symptoms, then that's when the liver disease is more advanced, and that will be able to detect it through also through blood work that is just going to show that the liver is not functioning well. As to how severe it is, it can be quite severe. Cirrhosis, it is a serious condition, and of course, if it's not managed properly, it can lead to death. When someone presents with an acute alcohol hepatitis, when the individual doesn't respond to the medical treatment, we can see mortalities close to 30 to 50% within 3 months of diagnosis. So it can be quite aggressive and severe.
So in terms of social drinkers, can someone who drinks alcohol socially get alcoholic hepatitis? And if yes or no, is there a safe amount that you can drink for both men and women?
It will be unusual for someone who is a social drinker to develop something like an acute alcoholic hepatitis. The reality is that for this condition to develop, the liver should have already sustained some degree of damage over time. So in someone who is just drinking a few units of alcohol on a weekly basis or on a monthly basis, it's unlikely that that's going to happen. Not impossible, but unlikely. In terms of safe amount of alcohol, there is no risk amount. There are low risk recommendations that we can make, and some of the recommendations vary according to gender. But what we would say is that a man should not drink more than 3 units of alcohol on a daily basis and no more than 15 on a week. For a woman, no more than 2 units of alcohol on a daily basis and no more than 10 units on a weekly basis. But we can see, unfortunately, some people have alcohol-related complications even with lower amounts of that. Although these are low-risk recommendations, it's important to remember that there is no risk recommendation that we can make.
And are there certain risk factors or genetics that can predispose someone to develop a more significant alcohol-related liver injury than someone else?
Well, absolutely. I mean, essentially, a lot of people who drink actively and large amounts of alcohol will not develop necessarily liver disease. And people that drink a smaller amount could end up developing liver disease. So that shows that there are some other conditions that sometimes need to be in place for liver disease to develop. We have looked at several of them, and of course, we have mentioned gender. Women can develop liver disease with less alcohol use. There are, probably through some genetic mechanisms, ethnicity can be a risk factor as well. We see that some ethnic groups are more at risk of alcohol-related liver injury. If the person has other conditions that could increase the risk of liver disease, such as obesity or hepatitis C, hepatitis B, that can increase the risk. Malnutrition and being malnourished will, of course, also be a risk factor for alcohol-related liver disease. So all of these can interplay in a certain way to increase the risk of having liver disease related to alcohol.
And for those that do drink more than the recommended, so more than the low risk, how many years typically until they can potentially develop cirrhosis or fatty liver or some of the consequences of drinking?
Well, of course, it can vary according to the amount that is consumed and also other potential risk factors. Um, in It's not something that necessarily develops over a few months. I mean, over a few months of heavy alcohol use, we could see fatty liver showing up, but to the extent of developing severe manifestations of liver disease, it can take several years. Usually will take, I would say, close to 10, 15 years of heavy alcohol use, but we certainly see some individuals presenting after just 4 or 5 years of severe alcohol use with a very advanced liver disease.
Okay, so if you fall in that category and that happens, if you stop drinking, will it reverse the disease you've developed? And how long would you need to abstain for to start seeing results and benefits?
Well, if there's a good thing about alcohol-related liver disease is that among the various types of injuries that we have that can occur with the liver, it's one that with abstinence, the liver can rejuvenate and the liver can return to a degree of function that will almost look like normal. In someone who has just early manifestations with a little bit of fat in the liver, maybe a little bit of scarring, that can easily be reversible. But we can also see people presenting with very severe forms of liver disease that after a few months of abstinence, that their liver function can improve and almost look normal to someone who's not aware of any liver-related problem with that individual. So it takes several months. So one has to be patient. That is not going to happen overnight, and that especially if someone has a severe manifestation, then we need to be patient, and we need to follow this person closely to be able to really see what the trajectory of the person is. Is it one that is improving, one that is stable, or one that actually, despite the abstinence, that the liver continues to deteriorate?
And what kind of resources can doctors offer for their patients? So if they are suffering from alcohol-related liver disease, how can they help promote abstaining or reducing drinking?
Well, I think it's a team effort. I think that it all starts by probably being truthful with your doctor about your alcohol consumption. And sometimes there is a very important distinction that we need to make, is that it is an alcohol-related liver problem. That doesn't mean that you are necessarily an alcoholic. We have people that come in with small but regular use of alcohol, so not a problematic alcohol use according to our society standards, but just that over time, over 10, 20 years of regular use, it has damaged the liver. So if we're honest about our alcohol consumption with our healthcare practitioner, then it allows our doctor to check the liver from time to time, and then notice when things are off, and then when we need to address the alcohol consumption. Now, after that, as I said, abstinence is the treatment of alcohol-related liver disease, and we have to work on reaching that abstinence. If the person needs to be referred to addiction specialists, to our alcohol use disorder specialist, maybe contemplate about different programs for alcohol rehabilitation in cases that are people that have really problematic alcohol use. The majority of times, what we need is awareness, and be aware that, oh, there may be a problem here, so maybe I have to cut down, I have to restrict myself, and that's all what we need. we also need to be aware that alcohol can be a problem when used in excessive amounts. And I think that that's a part of the conversation that needs to happen, not only between the patient and his healthcare professional, but also I think as a society to recognize that it is not a practice or a habit that is free of risk.
Absolutely. And maybe to follow up on that, so I know in the news right now, there's been a lot of, given the context of the pandemic, information that drinking in Canada particularly has gone up. So what are your thoughts maybe on that and what that's going to lead to, and how do we, as healthcare providers, plan to tackle that in the coming years?
Well, it's a very good question, and certainly, I have seen that coming to my office very frequently. That problem of the alcohol use increased during the pandemic. I would say that this situation offers a possibility to address the issue. First of all, as I said, being truthful. If there has been an increase in alcohol use, recognize it and see how we can change that, how we can also reduce the alcohol use during this period of time. And try to see how we can involve other professionals into this practice when the alcohol use is problematic. We have several professionals that are seeing patients, and we have several activities that are being conducted also through internet platforms that can be useful. I think that really the problem may arise by not knowing that, first of all, the dangers of alcohol use, and also not knowing that maybe the consumption that we have of alcohol is or could be problematic. And that really the only way that we can modify that is by really intensifying the campaigns of information towards what is a low risk alcohol consumption, and be aware of where we are.
So then, as an individual, what are sort of the questions we should be asking ourselves so we can be more aware of our own potentially problematic alcohol use, apart from number of drinks maybe consumed above the low drinking guidelines?
So one of the first questions would be, have I had so far a problem related to alcohol? Okay, so it can be a health-related problem. It can be also a legal-related problem or a workplace-related problem. So has alcohol already caused some kind of problems in my life? Okay. The second way to probably self-assess that is, what happens when I don't drink? Like, how do I feel when I don't drink? Do I need to have a drink early in the morning to feel that I can go and face my day? Can I, do I get annoyed when people make comments about my alcohol consumption, for example? And do I feel guilty about my alcohol consumption? If those questions have already been raised by the individual, then they may be a sign that there may be a problem, and then it's important to go see your doctor and just ask, do you think that my alcohol consumption could be problematic? And then it can be discussed, it can be tested, we can assess how the liver function is, or other health-related issues that could also be influenced by alcohol. And then if there is a problem, then at least we are aware and we can address it.
Great, thank you. So for the next question, what are the treatment options available for alcoholic hepatitis? And when does one know that they potentially are nearing having to need a transplant?
So the alcohol hepatitis question, it's actually a very interesting one because the treatments that we have for alcohol-related hepatitis are very limited. So what we try to do is reduce the inflammation that is ongoing by treating with some anti-inflammatory medications that we call prednisone or prednisolone. And the goal of that is to decrease the inflammation. There's research going on into other types of treatment that can be added, and certainly other products that have been attempted. But the only one that seems to be effective is prednisone. And even that, there's still some questions being raised about it, but we use it because there's nothing really more than that. After that is, as I said, abstinence and waiting it out, okay? Now, that when we need a liver transplant, that becomes a little bit of the job of the liver specialist in recognizing all these little clues that we have with the blood work, with how the patient is behaving, their symptoms, and then decide, well, this person, even with ongoing alcohol abstinence, he's not going to get better, or he doesn't really have that much time to just wait it out and see. That person needs probably to be considered for transplantation. It's important to also distinguish that there are two presentations of advanced liver disease. There's the acute alcohol hepatitis, but there's also the cirrhosis component, which is more that the liver has reached not by a process of active inflammation, but just by chronic damage, a stage where it's simply not functioning well anymore. And they do have different levels of potential to recover from just with abstinence or with the aids or not of some other medications.
Okay. And then a little bit back onto the topic of transplants. Is someone still eligible to be listed for a transplant if they have ongoing use? Or what are the parameters like in order to be able to be considered for a transplant?
So the topic is controversial, and definitely different authorities or different transplant centers will have a different approach or different criteria towards transplantation in the context of alcohol. Historically, we used to require an abstinence period, and maybe some people have heard about like the 6 months rule or the 6 months abstinence rule. So a period of time that the person should remain absent before being considered for liver transplantation. Now, this 6-month abstinence rule is pretty much like being abandoned step by step in different places. So now, instead of just going through a abstinent period of time, what we are performing is a global assessment of the individual to understand and quantify or qualify the risk of returning to heavy alcohol use after a liver transplant. And then if after that global assessment, which is a bit more subjective, we feel that the patient is at low risk or an acceptable risk, the person could be considered for transplantation. If the person is considered to be heavy risk, then it's not going to be offered. Now, one of the general rules is that if someone didn't have, and there's really nothing to prove that the person had a knowledge of their alcohol problem, and they were still drinking until the time that they presented, but they were drinking because of ignorance of their alcohol problem, we could consider an assessment for that individual. That is generally not going to be true if someone presents with liver failure because despite knowing that they had liver disease, they continued drinking. They did not stop. They did not try to stop, and they just continued damaging their liver.
And so for our last question, this is a little bit more historical and touches a little bit about the stigma of liver disease. This is a question from the audience. When I say I have liver disease, why does everybody assume that it is from alcohol?
Well, as you said, it's historical. I mean, until recently, and by recently I mean probably the last 100 years, 150 years, we didn't know about hepatitis A, B, C, autoimmune liver diseases. We didn't know that at all. So the only thing that people were associating with liver disease was also the fact that they were drinkers. So that had information, or that knowledge has just been transmitted through sort of generation to generation, and it becomes part of a little bit of a general knowledge or popular knowledge. But it is a misconception, of course. Not everyone with liver disease has alcohol as a problem. I think that we have a job to continue informing and educating people, but also I think that it's important for someone who has liver disease to continue informing that I have this condition and it has nothing to do with alcohol use at all, and try to break the stigma that way.
Great. Well, thank you so much. That was the end of our questions. It's been a pleasure having you. Thank you.
Thank you very much for having me here today. Okay.